Hi, and good afternoon. My name is Joe Volan, and I am an Assistant Director of Alumni Relations at Lewis University. I would like to first thank all of you for attending and participating in this webinar today on enhancing the success of students in nursing school. I'd like to thank our presenter, Dr. Donna Martin, who is an Assistant Professor here at Lewis University, and also the President of the Lewis University Nursing Alumni Network, who's sponsoring this webinar. If you have any questions throughout the entire webinar, please just send them into our email account, alumni@lewisu.edu. Again, that's alumni@lewisu.edu. And we'll be able to answer those at the end of this presentation. Thanks.
Hi, and thank you very much for attending this webinar. I'll be talking today about the impact of study sessions on first semester nursing students. So I recently completed my DNP, and part of my DNP scholarly project was to focus on first semester nursing student retention. So the purpose of this presentation is to present some of my scholarly project and then talk about the findings and how we explore options to help improve the retention of first semester nursing students. The U.S. is projected to experience a shortage of registered nurses that is expected to intensify as baby boomers age and the need for health care grows. So there will be a need for more nurses due to the aging society as people are living longer, expanding roles such as advanced practice roles that nurses can now participate in, advancing technology, which goes along with the expanding roles and more highly specialized nursing, and the aging nursing workforce. The average age of a U.S. RN is 47 years old. According to the Bureau of Labor Statistics employment projections in 2012 to 2022, that registered nurse is going to be one of the top occupations in terms of job growth through 2022. And the nursing workforce is expected to grow from 2.71 million to 3.24 million by 2022. So this is an increase of 19%. So in order for us to fill all of those positions, we need to help make sure that nursing students are successful as they tackle their educational endeavor. Compounding the problem is the fact that nursing schools across the country are struggling to expand capacity to meet the rising demands for care given toward the national movement with new Healthcare Reform Act. Based on all of this, it is critical that nursing students be successful once they've been accepted into a nursing program. So my project was completed here at Lewis University, which is a mid-sized liberal arts university in Illinois. The BSN nursing program has been part of the university for over 40 years. And this past fall was the most declared major by incoming freshman students. They do 3 semesters of general education courses and then begin their nursing courses in their 4th semester, which we refer to as a sophomore 2. This is where we tend to have the highest fallout rate once they begin the nursing curriculum. The attrition rate of first semester or sophomore 2 nursing students is higher than desired, and the contributing factors are multifaceted. These contributing factors include a more liberal admission criteria here at Lewis University, which is part of the mission, a significant increase in the nursing course workload for first semester nursing students. It actually is quite a shock for them as they suddenly are coming from gen eds and needing to spend so much additional work on their education for nursing courses. And they may have poor study habits, and again, taking into account that whole intensive nature of the nursing programs. Nursing attrition rates are a concern to university administrators, nursing faculty, prospective and current nursing students, and employers. A lot of the employers in the area around Lewis University highly regard Lewis nursing students and frequently hire them. So the consequences of not addressing this issue might include a decrease in the admission of candidates, the loss of credibility in the community, loss of qualified nursing faculty, and potentially loss of program accreditation. The accrediting agencies for nursing programs look for a less than 30% attrition rate. And of course, we want our reputation to stay where it currently is as a very well-respected nursing program in the Chicagoland area. I bring up our values and mission here at Lewis University because this was actually the impetus behind the development of this project to enhance or increase nursing student retention. So when we look at the mission statement here, it includes distinctive values that guide the university in fulfilling their mission, and that's knowledge, fidelity, wisdom, justice, and association. Lewis promotes the development of the complete person through the pursuit of wisdom and justice, and fundamental to its mission is the spirit of association, which fosters community in all teaching, learning, and service. And truly, that is where my project stems from, is really taking that commitment to student learning through collaboration with the students and collegiality. So with this, that led to a review of the literature for ideas of how we could try to enhance nursing student retention. This review of the literature was completed, and over 50 articles dated 2008 to 2014 related to retention, attrition, and success of nursing students was reviewed during the course of this project. It was noted that nursing student success is multifaceted. Shelton, in 2012, acknowledged that a nursing program must not only attract qualified students, but also ensure that students will graduate as competent caring professionals. This author also noted that students who felt they had a strong faculty support were much more likely to be successful in the nursing program. And I was actually drawn to this one quote because I felt that if we're going to have students come to Lewis University along with the mission, we need to do what we can to try and ensure their success. Other literature identified high-risk nursing students in different programs and found that there were multiple variables that contributed to the success of their program. A list of 19 predictor variables for the study by Hopkins were used to examine the likelihood that students would be successful in their nursing fundamentals course. And there was a strong correlation between their SAT or ACT score, high school GPA, and a nursing entrance test. So it's been identified that out of these 19 predictor variables that there are certain criteria that students should have when they're coming in the door to help ensure their success. There appear to be many other variables that may influence the success of students too that aren't included in this conversation here about their home life and other things such as work that go on and contribute sometimes to pulling of their time away from schoolwork. But when we talk about studies from Hopkins, the investigator concluded that early identification of at-risk students provides the opportunity to better support these students to be successful. So catching them earlier is better. Attrition due to academic failure was a concern at a baccalaureate nursing program in Pennsylvania. This study was done by Brown, and Brown said in an effort to enhance academic success, they found that it was important to have a support group for students that would provide guidance, feedback, problem solving, and peer support. This support group met weekly, and students committed to regular attendance. The students that participated in this support group were noted to have significant difference in academic success and had a reduced attrition rate compared to those students that did not participate in the support group. Although this was a small sample size, the investigator noted that these students continued to be successful through the rest of their program and passed the NCLEX exam. So again, we're seeing that providing support outside of the classroom is important for students. Harding implemented a targeted course to assist students over the course of a semester. The author for this study acknowledged that at-risk students would be the ideal population to participate in this course, although it was offered as an elective course to all students. The findings of this showed that supplemental instruction did have an impact on student success during the immediate time frame, although it didn't appear to benefit the student over time. We also noted in the literature review that I did that caring and providing a caring environment can have a positive impact on nursing student retention. Nursing is known as a caring profession, so therefore, as nurse educators, it's important for us to go ahead and share that caring with our students and nurture them, mentor them, and instill self-confidence in the students. McGann and Thompson also investigated contributing factors of success and academic failure in nursing students. This study identified at-risk students, and they attended a weekly class that included discussions, additional content review, and assignments. And topics that were covered in here included learning styles, time management, stress management, test-taking strategies, and reviewed the content that they were learning in their courses. The findings supported faculty mentoring, and recommendations included offering interventions such as a regular group meeting and faculty mentoring earlier in the nursing program. Well, it just continued to go on as the literature was reviewed that there were many different things that could be done to help improve the success of our nursing students. There were studies also that looked at what type of learner they are. Currently now our students have a little bit different learning methodology than many of us who went to school years ago, where now they're using more multimedia approaches and they like the hands-on activities and need more experiential learning. So by offering a variety of teaching mediums and making adjustments in the traditional method of teaching will be helpful to the current generation of nursing students. In another study that was conducted, it looked at variables such as combining lecture and additional teaching strategies with group discussions. The students that actually received the lecture with structured group discussions outside of the classroom performed significantly higher on exams than the groups that did not have the discussions added. So taking all of the different studies that were found, it determined that supporting student success by reducing attrition would take looking at student characteristics, so looking at the characteristics of the students in our program, using support groups so that the students actually felt that caring atmosphere, strategies to support student success such as having them meet with faculty through study sessions, support groups, content review. So there's a variety of different strategies that could be used. So taking all of those into consideration, one of the things that was decided for this project was that all students would be hopefully able to pass their courses in nursing as a sophomore too if they attended the study sessions. So by giving them some additional opportunities to utilize test-taking strategies, to learn about study strategies, to cover some content review, to look at time management. So the best of all the literature was taken and put into one program. The thought is that these interventions would help enhance nursing student success. So our objective was that all students that participate in study sessions will successfully meet the academic requirements for their first semester nursing courses. And the goal is that make sure that we had an increase in first semester nursing student retention to greater than 70%, because we want to make sure that we're meeting accrediting requirements, but obviously we would like that number to be much higher, so the goal would be to have as many students as possible be successful in their program. With the ultimate goal, of course, of students that participate in study sessions during their first semester nursing courses will successfully progress through all of their nursing courses, graduate with their BSN, and successfully pass the NCLEX exam on the first attempt. So the intervention that was developed for our students here at Lewis University was study sessions. And the goal was that all sophomore 2 students would be invited to participate in a series of moderated study sessions that would occur several times during the semester. Ideally, this would happen every other week, with each session lasting 90 to 120 minutes. These sessions would include a review of content that was currently being covered in their health assessment and nursing fundamentals courses, NCLEX style practice questions, because they're all stressed about those, stress management techniques, time management techniques, and study strategies. So the implementation of these study sessions was planned for the fall of 2013 and the spring of 2014 semesters. Because we offer all courses every semester, the goal was to do this over 2 semesters and get a feel for how well this was being received by the students and the effectiveness of this. So in our fall semester, we typically have more transfer students, and the spring semester, we typically have more of our traditional students that start as a freshman. The numbers vary anywhere from 70 to 100 students that would start nursing for those semesters. Since there was a variation in the number and type of students between the fall and spring groups, it was decided to have it expand over those 2 semesters so that we could account for this variation. So it was very exciting putting all of this together and offering it to the students. Did have a few glitches there, which of course most things go with a few little glitches. But in the fall of 2013, 5 sessions were offered to the students. They were offered every other week, but unfortunately they didn't get started until later in the semester. They started in October, and students had already had an exam in both their fundamentals and in their health assessment classes. I went to their classrooms and discussed what the study sessions were all about, and then I sent them reminder emails prior to each study session. So you can see by the numbers with the 5 study sessions that it started with the first one with 20 participants, then we had 18, 12, 10, and 11. So there was a fall off in the number of people that participated in the study sessions. And if you look at the number of sessions attended, 19 of them only attended 1 session. But we'll talk about some of the questions that were raised based on this information in a few minutes. Spring 2014 started right outside first week of school. I had already talked with all of them at their success day, and we're sending reminder emails, and the first study session was week 2 of classes. Was able to do 6 study sessions every other week, and because of the additional publicity, so to speak, and being out there and really sharing with the students what it was all about, we found that first study session I had 39, 8 at the second study session, but that were an extraneous variable that day. That was a snow day. So on that day, they closed campus at 4 o'clock, and the study session was between 3 and 5. But I still had 8 students make it out here in the snow because they were interested to come to the session. But you can see the numbers were greater. We also had more students in the program that semester too. But you can see there are some variations. Again, we had 16 students come for 1 session, and then the numbers started to fall off. Now, I can tell you that it raised some questions as, do we need to do study sessions every other week, or should study sessions just be offered once or twice at the beginning of the semester to help get the students off on a good start? So we'll be coming back to that shortly. So the results were that there was a significant statistical difference between the number of sessions that they attended and the students' success. And we found that more students in spring of 2014 were successful in the health assessments and fundamental courses, which I would attribute to the fact that we started the study sessions before they had any exams, so they weren't already behind the 8 ball when the study sessions started. The students there filled out a survey each time too, and they said that they found them to be very helpful. So when we looked at the number of sessions attended, you can see that students were attended a variety of different ones with their success. So students that attended one session had a 91.9% pass rate, where students who only attended 4, we had a 60% pass rate. And I like to just clarify that when we got into the 3, 4, and 5, unfortunately, the numbers don't look as good, and that was the semester that we started later in the semester. So the students were, I had some diehard students that continued to come, said they found it helpful, even though near the end they were at the point where it was going to be very challenging for them to pass the course with their final exam. But as you can see, the students who came to 6 study sessions, which means they all came to the second semester, we had a 100% pass rate. So the more sessions they came to, the more likely they were to be successful. And again, this is just another recap of that information, just looking at it from a different perspective. But I have to say we had the highest pass rate that we had in a long time in spring of 2014 for our first semester nursing students. So it was very exciting to see the difference, and you can see that 93.2 of them percent passed and progressed on to the next semester. So they passed all of their nursing courses. When looking at the pass rates, I also had put together a diagram because, again, I wanted to show administration how important it was and the effect that it had on the students to offer this to our students. We had done a curriculum change back in fall of 2012 and revised our nursing program here at Lewis University. And I included some data from before that also because I wanted to make sure that we were comparing and looking at the impact that the study sessions had overall, taking into account the fact that the new curriculum went into effect in fall of 2012. So you can see the 2 semesters before we changed our curriculum that health assessment and fundamentals really were struggling with our pass rates for those students. As you can note in the green, it says sophomore 2 overall. That includes our repeaters and those students that just had to take patho. When we went from our old curriculum to our new curriculum, we saw an increase in pass rates. And then when I implemented the study sessions, the first semester, remember I started those late and they were not as effective, but when I started them at the beginning of the semester, we had a significant increase in the number of students that passed their nursing courses and progressed on. This is great news. This is exciting. This is an opportunity for us to help to improve our student success rate. The participant evaluation tool that I gave them allowed them to rate the different topics or the different aspects of the study session that I was hoping to accomplish. And I pulled all those based on my review of the literature. So when I asked them about, did they find the study strategies helpful, test-taking strategies, the review of the content, collaborating with others, and down the line, the students overwhelmingly found all of these things to be extremely helpful. They did fill out a survey at the end of each study session, so I ended up with one tool for each time somebody came to a study session. But again, these topics that were included were similar to the themes and topics that were found in the review of the literature, making my evaluation to help support what's out there in the literature as being effective. Participant feedback, You can see that overwhelmingly they found it very helpful. I had 172 surveys, although not every question was answered on each survey. That when I looked at the questions, these are some of the basic questions that we had asked. There were a few that they were allowed to ask or answer regarding frequency of study sessions, wanting to know if it was just right, not enough, or too much. And interestingly enough, 74% of the students said that every other week was just right, and 26% of them said it was not often enough. They actually wanted study sessions more regularly than every other week. When asked about length of sessions, 90% of the students said it was just right, and overwhelmingly 99% of them said yes, they would recommend to classmates if they had the opportunity to encourage them to come to these study sessions. There were many positive write-in comments that they appreciated practice questions and content review and felt like somebody cared about their success here at Lewis University. So the implications of doing this is that we identified now that by providing an additional resource, such as study sessions that were moderated, and what I mean by moderated is that what we had developed there was a packet of NCLEX questions regarding the topics they were currently studying that they did in groups. So they worked for about an hour as a group to try and answer these questions. And then we went over them and talked about all of the different questions and how to interpret them, why it was right, why some answers were wrong. So it really allowed the students to have a faculty just there to ask questions as they were going through the packet, and then to help explain rationale for the correct answers. Providing a few study sessions early on might have a more significant impact. So even though they may not have come to all of them, it seems as though that if they attended study sessions early on, that they had a more significant impact in how well they did for the remainder of the semester. So maybe they just needed some guidance on how to take NCLEX questions, how to study for nursing exams, and how to kind of organize their life for this new hard curriculum that they were now part of. And one of the things that came out of this was that there was a request to continue to do these study sessions. Both students and the coordinator of retention asked about the study sessions continuing. So the next steps that were to be taken here is that this project actually opened up the door for exploring new options to improve nursing student retention here at Lewis University. And these study sessions have continued to be offered each semester since then. They've been offered bi-weekly. And just to give you an example, for this current semester that just finished, for the study session numbers, the word must be out, because out of 75 students, 59 of them came to the first study session, 55 to the second study session, and then we started to see the fall off, 36, 29, 10, and 16. So again, it still raises the question, do they need the study sessions offered all semester, or do they need them just in the beginning to get them off on the right track? But for now, this is going to be continued here at Lewis University. It's found to be beneficial by the students as well as the faculty. If it's going to be continued as a permanent fixture here at Lewis, there will be some questions that will need to be answered. And we also will need to look at, should we consider adding patho, because that's another course that's during that first semester of nursing courses, or do we continue this program at other levels? There was initially some concern that if we helped students along with doing these study sessions their first semester of nursing, would they then have problems the second semester because they didn't have that same support? Well, as of this point, that has not shown to be true. I'm continuing to follow these students as they progress through the program, and there has not been an increase in the number that are falling out or not being successful later on in the program. So the future of nursing really falls on us as seasoned nurses. We want to be able to seek creative ways to support nursing students And we need to seek ways to support our new graduates. Many hospitals now have put into place additional resources to help students and to help new grads. Here at Lewis University, we actually have a mentoring program. Currently, our mentoring program involves higher level students mentoring the younger students that are in the program. This has been very successful in helping the students to feel connected and to feel like they had a resource of someone to go to when they were struggling in their courses. We also would like to promote nurses being mentors for new graduates. And whether it's new graduates or even students, I will tell you that I take students to clinical, and the floor that I take my students to, they open arms to the students. They're excited to have them there, and that's important. We were all students once, and it's very important that we feel, respected as a student and that somebody wants you there. But here at Lewis, we also are looking at the possibility of starting a mentoring program where nurses might have the ability to help mentor new graduates or younger nurses as they begin their career to help get them through those rough times. And that is something that's being explored through LUNAN. Many hospitals now have internships where student nurses can actually get jobs during the summer and work in the hospital, and that allows them that extra connection, as well as residency programs for new graduate nurses. More hospitals now have formalized orientation that typically spans about 12 months. So they have a meeting every week or once a month with the other new graduates that were hired at the same time as them. So this enhanced orientation provides a year-long support for these students and new graduate nurses. It is critical that we, as a university and as a profession, continue to find ways to support nursing students and new graduates to be successful. If not, who's going to be there to take care of us? Consider the next time a nursing student is assigned to one of your patients to lend that extra hand and help guide them through their day. When you have a new graduate nurse on your unit, to lend them some guidance also. And seek out opportunities to get involved in helping to mentor those that are the future of nursing. I've listed here my references and my contact information if you should have any questions regarding the presentation today at a later date. And at this point now, we're going to open it up for questions.
All right, we do have one question. It comes from Sarah in Chicago. Donna, you mentioned LUNAN. What is that, and how do you get involved with it?
Oh, great question. That's Lewis University Nursing Alumni Association Network. And with that organization, it is if all of the nursing students that have graduated from Lewis University are automatically part of LUNAN. We're part of a unique, special group of people who have graduated from Lewis University and now have a connection with other nurses through the Alumni Association here at Lewis University. It's a newer organization. It's been in existence for a few years, and it has really done a great job in trying to help pull together some alumni that have majored in nursing and are doing different things to help promote a positive impact on the profession. So we've had some mentoring events and a few social events and connected people together that otherwise may not have been connected.
All right, thank you. And so if anyone has any questions after this that they would like passed on to Donna, her information is on that slide. You can just go back and revisit this webinar later. It will be posted on YouTube as soon as it's completed. Or you can feel free to send our questions to alumni@lewisu.edu. I'd like to then take this time again to thank Dr. Martin for presenting on this wonderful topic and sharing this information and this knowledge. And thank you all for participating. I hope you have a great day and enjoy your weekend. There are also a couple of upcoming events that we'd like to draw your attention to. The first is the Red Tie Ball that will be occurring on September 12th, and the second is the Celebrating Women in Leadership Conference on October 9th of this year. To find more information on those and all of the events that are sponsored by the Alumni Association, please just visit alumni.lewis.edu. Thank you and have a great day.